Perfect. So, good afternoon, everyone. This is so exciting for having 35 providers and our partnering programs join in to this most informative session that we are holding as a lunch and learn session for the month of May. This session is going to be on WIC, and we have Mara Andrews. Is that how I pronounce your last name? Is that correct, Mara?
Andrus, yeah, that's fine. Mara Andrus.
Mara Andrus. She's a nutrition consultant for public health, Seattle King County, WIC. And she's been working with WIC for over 20 years. And her focus is now on federal, state, and local policies, with providing trainings for public health teams and outreach, and also establishing partnership connections in the community. So just to give a quick background as to how I connected with Mara, public health has been our long supporting program. And there was just one meeting where Mara had graciously attended, and we just started talking about these lunch and learn sessions and stuff. And she was like, yes, I would love to, come in and talk to the network of partners. And she was so kind to give her time. And I think, Mara, we scheduled this talk back in February, if I'm not mistaken, right?
So. I totally forgot about it. It's been so busy.
Yeah, that's all good. And that's how we are here. And I so appreciate everybody for your time and making sure that you RSVP for this session, because your time is so valuable. And also, it is justice for the efforts that we put in to make sure that we bring in such eminent folks and talk to you. So without wasting any more time, I'm going to request Mara to address this group. And if anybody has any questions, either you can put it in the chat window, which I would be monitoring. If not, I think if it is okay, Mara, they can raise their hands and they can ask you, or they can wait at the end and ask questions. But Mara is very open to you all asking her questions. So feel free to ask as many questions as you have. Ultimately, the aim is that you take all this information back to the program and your organization and the families that you're supporting. So with that being said, I am going to share my screen.
Okay.
And then I will let Mara take it forward from here.
Well, thank you very much. And welcome, everybody. I'm glad to get a chance to be here to do some outreach and talk to all of you about what Public Health Seattle King County, WIC, and our community partners can do to help your participants that you work with out in the community with boots on the ground. We have 38 clinics that we partner with Public Health Seattle King County that are, some are WIC only, and some are part of our family planning and some of our other programs, dental and like that. But we have a WIC clinic in every one of those 38 clinics throughout the county. Some of them are our community partner sites, where we work with like Kaiser and Swedish and ICHS and a Country Doctor and Odessa Brown. And Kaiser's. Those are some of our partners that we support those WIC clinics as well. WIC is a federal program, so there's a lot of policy and there's a lot of change constantly. Gosh, the last, even before COVID, there was a lot of stuff going down with the food bill and all kinds of changes to Congress with, trying to make healthier options for the WIC program and to get more money to support breastfeeding peer counseling, to help support breastfeeding out in the community, and to help with partnerships. And then COVID came, oh my gosh. And then we all kind of tried to go virtual, so that now we have an option, speaking about, change with the WIC program by 2023 here, we can do a lot of more virtual appointments and class options and things that we can do that we couldn't do 3 or 4 years ago before COVID, because it was just kind of a slow process to get all the approvals and to get, federal dollars spent certain ways and all of that. So I feel like it's really exciting right now. The WIC program is kind of staged to do some we have some cool opportunities to do things in a little bit of a different way with continuing remote services, as well as offering pretty cool in-person services at clinics that are going to have maybe later hours and maybe some Saturday. We have a few clinics with Saturday hours now, mostly in South County, but a lot more options coming up. I would refer you to, and we'll go through the PowerPoint a little bit too, but all the changes that have come and will be coming. Our King County Public Health, Seattle King County website, our WIC page, has a lot of information, and we keep that updated very well. So that would be a place where I would refer you. We have referral forms for all of our different programs in public health, from the First Steps program to Nurse and Family Partnerships, some of the programs that you all probably work with, to Family Ways, CHSCN, those types of programs. We have referrals through our WIC program as well, right there on that page. So I guess I was just going to start a little bit about I was talking a little bit about the changes, but the state WIC program is anticipating possibly doing a statewide referral program to clinics around the state as well. So once that gets out through, I believe it'll come out through either 211, as far as the outreach, or Help Me Grow Washington. That'd be a good way to refer to us as well, besides just, calling either our call center. We do have a call center for Public Health Seattle King County, or to call a specific clinic, which you can do by looking at our website and see where the specific clinic that's close for your participant is, and call and get an appointment. I will say, and some of you might have noticed this, I don't see any hands raised right now, but we have been very, very busy, and our clinics have been, due to some changes within our public health system structure, we've been a little bit on the lean side with our staffing, and we have been overwhelmed a little bit with new clients, especially in the last 3 or 4 months with the SNAP benefits being decreased and the anticipation of that. We have a lot of people applying for WIC, and we're getting to them as fast as we can. If you do have any issues or questions, you can always, of course, refer back to me, because now you have a contact with public health. Part of my role as liaison is to work with outreach in the community. So I'm more than willing to answer questions and to talk to people in your area as well. And I do have coordinators at all the clinics that I work with that are out in the community, or try to get out in the community. We are doing more outreach and boots on the ground to be actually present at outreach events. So keep that in mind as you're working through some of your things that are coming up this spring and summer. A lot of our providers support refugee and immigrant populations. And again, a lot of the caseworkers reach out directly to our call center or reach out to our clinics, and we're able to get them, an appointment. And then we absolutely have interpretation services in, any language that's come across our desk, and all of our state WIC important documents that need to be, that talk about the program, that talk about the food packages, that talk about all the benefits the WIC has. Those are all in, I think we have 17 languages now. And we have a super cool shopper app now that goes along with our electronic benefit WIC card. I don't know if all of you are up to speed on that, but right before COVID, we got electronic WIC benefits, which was huge. We didn't have the paper checks anymore, and that's been really progressive. And thank goodness we had that when we had to go remote with our services during COVID. That was a real benefit. So we have a shopper app that goes with that does have actually some language help along with it. And at this point in the state of Washington, 94%, I think, is the latest data of our participants do use the shopper app, which is great, because we can put messaging across the bottom of that app that talks about, when we had the formula, all the formula issues, which a lot of you may have heard of. It was a tough year last year with getting folks what they needed for the infant formula for their babies. So messages would go along for that. And then like now we'll have messages coming along with the farmers market program. So there'll be a lot of information, because farmers market is going electronic this year, and it's going to be using QR codes, so that folks will be able to use their fresh fruits and vegetable benefits directly at the market. And also they have, I'm going to talk about it a little bit here, but just as an overview of changes, we have a cash value benefit that the federal government approved during COVID, and that's for additional money that goes directly for our WIC families to use fresh fruits and vegetables, which to me as a nutritionist and for our WIC staff that are trying to promote, healthy eating and variety and different choices and ideas, the option to choose more fresh fruits and vegetables is just huge. That's been really, really a benefit. I will say a benefit of COVID that we were able to get funding to do that, and that has been so successful. And the redemption of the fresh fruits and vegetable money has been awesome. So we know that people really do want it and that they're using it.
With the hygiene.
What's that? Yeah, it is. It's been really exciting. So let's see. Let's just go ahead and look. We have fresh fruits and vegetable opportunities this summer coming up, and then of course in August we have World Breastfeeding Week and World Breastfeeding Month with different cultural weeks specific to there's Black Americans, there's Native American, there's Asian and Pacific Islander Week. There's several different aspects of breastfeeding besides just an International Breastfeeding Week that WIC fully supports, and we try to integrate with some of our outreach. I think let's go to the next slide, because I want to let you all know of something really exciting that Public Health Seattle King County is doing this summer. For WIC, and what WIC is, we are doing open houses at all of our main WIC sites throughout the county. So all of our big clinics, like our Federal Way Clinic, our Renton Clinic, our Auburn Clinic, Midway. Just a second, I'll talk about that. We cover young children up to age 5, yes. And mom out here, I'll tell you, and moms, breastfeeding moms, postpartum moms, and postpartum moms up to 6 months postpartum we cover, or all the way to a year. We cover moms that have had babies that are fully breastfeeding. And then children to age 5 at this point. Though the feds are looking to encourage that change to go to age 6 for children, and also to cover postpartum moms, whether they're breastfeeding or not, up to a year. That's in the works as far as possibly to be changed and improved upon with the WIC program in the coming year. So these open houses are a real opportunity. There's going to be it's going to be posted to our website, what's open, where, and when. Or I could send you the link or the information on when these open houses are, if that's helpful, because it might be kind of nice to go to one in your area if you have a chance, or to refer your participants to one of these open houses. I will tell you that kind of one of our goals with WIC administration is that during COVID, we had all sorts of our participants move all over the county, right? Just to go live with grandma, or to, they had to go to move south to get a cheaper place to live because they didn't have jobs. All these things happened, right, during COVID, and we were able to do remote visits, so they weren't having to come in. So we have folks that have moved clinics or moved all over, and we're not exactly sure where everybody is. So part of, besides promoting farmers market and the fresh fruits and vegetables, we want to encourage folks to start coming back in more and more to our clinics in person, to walk on in, be part of our, family and our situation, and to be connected with us, to be able to feel free to walk in when we're open and talk to us. And I think that these open houses, we're really hoping will get people coming back to their right clinic. And then we'll get more in-person visits as we move towards losing all of our federal waivers are going to change as of September of this year. We will still be able to offer remote, but we also are going to be offering we are offering in-person visits now, but we're going to be even doing more of that, as we're going to be needing more proof of eligibility and things that you need for the WIC program. So that's coming up. And probably what I'll do is I'll send that link to you when we're done, Rishka, yeah, for the open houses. And it's going to be on our website as well. So, but we have I think they go all of July and into the beginning of August. It's a couple days a week for, that we'll be out at those. So what is WIC, right? Helping helping women, infants, and children. I was just going to say, that it was in the 1970s was the WIC program was formed, for those of you who didn't know, and basically it helps to support up to half of our infants nationally with breastfeeding support and formula support, and moms that have had babies and need support. It's an income eligibility program, and so at 183% of the federal poverty level, you can qualify for WIC with a provider one. You can generally qualify, or there's adjunctive eligibility through other federal programs to qualify for WIC. And so there's the eligibility component to WIC. And then there's also, we determine, we assess for a nutrition risk factor. And then we also do, and food insecurity is definitely a risk factor. So pretty much anybody that is in that income level is going to have some sort of food insecurity, but we really we train our staff to, federally to do a good assessment, and we really like to get weights and measures, and we check iron, and we refer to physicians for lead. I mean, we really are an active participant of the medical community, as well as, you know, being supportive to the providers in our area that communicate with WIC pretty regularly. Actually, we're pretty functional within our you know, communities and areas with what we do to help support our participants. And then we do nutrition education. And breastfeeding education and breastfeeding support. And we are able to help folks with pumps and with referrals to all sorts of things out in the community, including probably a lot of you guys with what you do. We're required to make referrals as part of our WIC program, and it's a big part of what we do. I will say that, you know, a general referral to Help Me Grow Washington is required at every certification that we do. And certifications are required yearly with a half yearly health assessment in between. And then we will issue generally benefits on the WIC card, e-WIC card, for 3 months at a time. And then we do a quick check-in, which another cool thing that's coming up that's part of all of this change is we're going to have electronic second contacts. So in between the health assessments and the certifications, folks will be able to do an electronic email-based online nutrition contact, which will be like a little virtual class. And answer, and then get their benefits loaded that way remotely, and not even have to come into the clinic for that, which is something that WIC has always wanted to do, but we hadn't really been able to do before we had the COVID that kind of changed how we did our work. So that's cool, and that's coming as well. Probably right around after farmers market and into the fall, we'll be starting implementing that too. So lots of cool changes coming. And there's links here to our website and to all of that. And okay, let's go to the next line. And so as I had already kind of answered your question, who does WIC serve? Pregnant women, delivering a baby in the last 6 to 12 months, babies, and children under 5 years of age. So, and then let's go to the next one. And again, the eligibility is very important part of WIC, and it depends on your household size and income. It's a nutrition program for these pregnant women, new and breastfeeding moms, and children under 5, dads, grandparents, and other caregivers of children under the age of 5 may also be eligible to sign children up for WIC. And that's important to know. We get, oh gosh, I mean, since I started in WIC over 20 years ago, it has really increased as far as all the different custodial situations and family situations and so much of a variety of what we have now, right? That our world, it just keeps evolving in this direction. Foster children under age 5 and foster teens who are pregnant are all eligible for WIC. And if you or your family member are on Medicaid, temporary assistance for needy families, or basic food, you may adjunctively qualify. Many working families and military families are eligible for WIC. And then there's a couple of resources here that you all are probably fairly familiar with as well, with Help Me Grow Hotline and the Parent Help 123 Resource Finder, to see if you qualify, and then always to call, and we can let you know if you qualify as well. Okay, let's go to the next one. This actually, I just got the one that is effective Monday for this year today, for the new WIC income guidelines. I can send you that as well. And I have to update my slide. New WIC income guidelines just came through from the state today. So usually it changes just a little bit. It goes up just a tiny bit every year around mid-May. Well, actually, this is a little late this year. Actually, usually it's about around mid-April, to be totally honest. But anyway, so those income guidelines, I'll get those to you guys, or they're on the state website or on our website as well. Yep, they could totally qualify for WIC. Non-documented immigrants, yes, absolutely. We do not look at any. We do not look at any of that or that for not qualifying or for, and we don't report anything like that either. Refugees and immigrants are all totally, if they income qualify, they're totally able to qualify for WIC. And again, the language barrier and the language is huge. And what we tend to see is we'll get groups, right, from different, like from either a Ukrainian housing development, or, you know, that's close to one of our WIC clinics, or we'll get like at Midway, we have a whole bunch of Dari speaking folks that all kind of live close. So the word of mouth is huge, right? And they help each other to shop for WIC, and to, you know, when you come in as an immigrant refugee and the shopping is so strange and so different here, right? It's nice that they can, when folks live together or have family, that they can help each other with that initial shopping. Yeah. Okay, let's go to the next one. And so, like I was saying, what do we offer for participants? Health screenings, nutrition and health education, referrals, breastfeeding support, and the food benefits. The food benefits tend to be our biggest food packages for a breastfeeding mom, and that'd be about $80 a month, give or take, depending on the food choices that are made. There's a pretty good variety now, a much better variety than there used to be, I would say, with our WIC program. In the last 10 years, and especially during COVID, we were able to make some good changes. We have less fruit juice, way more fruits and vegetables. We have, you know, quinoa, lentils. We have different proteins and different grains than we used to have. We have tempeh now. We have tofu. We have kefir we can offer. We have a lot of different goat's milk. So different things that we can do to make the packages more culturally appropriate, and as well a little bit more variety for folks that have different food preferences, like the vegan choices or something like that. So that's kind of cool too. Let's go to the next one. So I think it's important to know, like when you're talking to participants, or, you know, if you're out in the community and somebody mentions WIC, I mean, you know, what do you expect from your WIC appointment? Because sometimes people, it's just too much work, or maybe it's just overwhelming to just get, you know, just get the food, or there's a lot more to WIC than just the food benefits. There really is. I mean, our visits for new participants, they can take about an hour. But if somebody really wants it to take less, we can make that work. We really try to listen and see, and you know, get the information we need, make people feel comfortable. And it's really important to us as Public Health Seattle King County WIC to establish relationships. We train to that, and we encourage that, and we support that 100% with our staff. I mean, we do have, probably over COVID, we've had a lot of staff turnover. We probably have about a third of our staff is fairly new. And newly trained, but we have seasoned staff that have been with us for 15 to 20 years. And I will say it's a pretty good mix, and they support each other throughout the county. And we really, really do like to meet people where they're at. And we do try to have these good visits, but a new participant could take a while, especially in language, because we do try to really explain the shopper app once we get them on the program and let them know what to expect, and then help them with explaining the shopping so that they actually can, you know, utilize those benefits when they get to the store. Yeah, so especially if there's multiple family members, it can take about an hour. And then, like I was saying, a follow-up visit every 3 months. But those are going to be able to be virtually going forward. At the end of each visit, the food benefits are loaded into the family account to be redeemed at a participating grocery store using the electronic WIC card. And the beauty of that is you could go into a grocery store and just buy milk, or you could and put it on your WIC card, you know, if it's an eligible WIC food item, or you could go buy a whole bunch. You could buy, you know, the whole grains, the dairy, the beans and rice, or you could buy like $50 worth of stuff, plus a bunch of fresh fruits and vegetables all at one time. I mean, as long as it's on your card for that month and it's eligible per month, the benefit amount, you can buy it at any time, whenever. It's no longer any sort of difficulty with paper checks and having a certain amount on each check or any of that. We're way cool with what we can do with our food packages now. And we can make adjustments. Like I was saying, these can happen at any time. If somebody wants to change to tofu from the milk they have, or they want to get rid of the cheese, or they want to change something on their package, they can call the WIC office, and a family, they don't have to wait till their next appointment. We really try to be proactive, especially that's been something we've had to do with formula because of all the changes, and people be at the grocery store calling us and saying that they couldn't find the formula they needed, and we would be able to change all that on the phone. The electronic benefit has been huge to be able to help us be more client centered. Okay, let's go to the next one. And this just shows you what the shopper app kind of looks like. And some of the cool features are that it does allow you to scan the barcode and see what is WIC allowed. And you can view the foods lists. You can use an I can't buy this to report a food that should be at the store that you thought that isn't. And then the state can work with the retailers and see if there's a reason. I mean, stores aren't required to carry every single food that is available on to WIC participants, but they are required to keep a certain percentage on hand if they're a WIC store. We have almost most grocery stores around the state of Washington and in King County are WIC stores. But for somebody, something nice to know if you're talking to a WIC, somebody that's on WIC and they can't get the type of type of grain they want, or they can't find the yogurt they want or something like that, they can go to the courtesy desk, right? And just ask. I mean, stores, the WIC program brings a lot of money into Washington State and into the grocery stores. So they oftentimes are willing to order something if somebody just asks. And then there's easy support, registering your WIC card and using the benefits. There's the 1-800 numbers, there's email links. And then you can also, the farmers market button, you can find out where the farmers markets are and what you're eligible for. All kinds of cool stuff. Where to find a WIC office or a WIC. We don't have WIC stores in King County, but regular WIC stores. We don't have special just only WIC stores, but to find a grocery store close to you, you can find that on the WIC app, the shopper app as well. Okay, let's go to the next one. So this is the CVB that I was talking about, and actually this slide is wrong. We're continuing through December of 2023 now. That just got updated again. They keep updating it like every 6 months, along with the federal waivers for the remote services. This cash value benefit kind of keeps getting updated. It really has been an amazing benefit. Like I was saying, I just think it's just been awesome that people are using more fresh fruits and vegetables, having the opportunity to get more variety. It makes our individualized nutrition counseling almost easier, really, because we have opportunities to just give more ideas and more thoughts and more, it's kind of exciting type thing. And so that emphasizes that bump. And yeah, it's triple produce purchases from WIC participants. So that's really cool. Okay, let's go ahead to the next one.
I think there was a hand raised by one of the participants. Do you want to take the question now, or
Sure.
we should wait?
No,
Martita?
sure. Yeah.
Yes, thank you. My most likely was a comment. I just
Okay.
want to say thank you. I heard inclusion and equity, inclusion and culturally. So thank you so much for including those grains, fruit, vegetables, or food that you said that people can request, because we have all backgrounds and from many different countries. So I just want to say thank you so much for considering that and for the inclusion. It's just a comment I want to say.
Yes, I agree 100%. The National WIC program has really embraced inclusivity, going 90 miles an hour ahead on anything we can do with inclusivity, and the food packages are reflecting that. And the changes that are happening faster and faster, to me, are amazing. With 20 years in WIC, it's like all of a sudden in the last few years, it's been like so much happening at once. I'm like impressed. It's like, wow. Yeah. Yeah, sounds good. And then these are the amounts of the fresh fruits and vegetables that are issued monthly. So if you have if it's $25 for children and $44 for a pregnant or postpartum mom and $49 for the breastfeeding participant, if you have 3 children and a breastfeeding mom, I mean, you'll have over $100 extra of fresh fruits and vegetables to use monthly. So for some of our bigger families, this has been pretty amazing. Along with some of the other fruit and vegetable options out there, and along with our farmers market program too, which we have started right now, and we do it on a first come first served basis. We are able to give a $28 benefit to family members monthly through WIC, but this CVB just enhances that like over the top. So yes. Let's go here. So now, like I was saying, our farmers market is starting soon, and if you see this picture in the middle there, we'll be out there looking just like that at many farmers markets this year. All of our teams, I believe, are going to a live farmers market at least twice, and promoting the WIC program and answering questions and issuing the WIC benefits onto the participants' cards, and then all of our major sites, as I said as well, are going to be having these open houses. But those will be at the site, and they'll be doing farmers market issuance benefit there too, and just talking about WIC and hoping that people will send their friends, and we'll hopefully be able to sign people up on the fly. Now that we're so good at being remote, we can actually sign folks up at these outreach events to get them on the program. So I feel like we're way more flexible than we used to be. And this just kind of shows some of the things that we do. We haven't had them during COVID, but we do have classes with our WICs, with our cooking classes at some of our WIC sites, and we'll be getting back to those. We've been referring to virtual breastfeeding classes at some of the hospitals, but hopefully we'll have our own soon with that. And yeah, just trying to have lots of opportunities, lots of different tools for folks to get information, right? And to be open to everybody and try to use, I mean, a lot of the things that we do with classes tend to be English and Spanish. But if we have a Ukrainian or a Dari specific group, we will try to do the translation in that language if we can for certain groups. With our different sites like I said, different sites have different emphasis depending where they are in the county. It's definitely noticeable that there's certain pockets. Yes. Yeah, it's super cool. And hope to get more and more. So these are just some links if you want, because you can send out these slides, even though there's a couple things we should update. You can send out these links and things after this presentation if that's helpful. And we do have videos for how to shop with your WIC card that we refer our participants to, and those are on our King County WIC webpage in English and Spanish. And we have how to use the food card and how to shop. And we also we'll have farmers market instructional videos, because it is a little different this year in that we're using this QR code approach. So it's going to be a little bit more it's going to be new to everybody how we're doing farmers market this year. So we will have a farmers market page on our website to explain that too, which might be helpful to know as you're working in the community too, if it comes up. You can help us spread the word that this QR code is what you'll do is you'll take this QR code that you get in the mail, and you'll take it with your WIC card, and you'll go to a farmer's market, and they just scan the QR code, and you can get fresh fruits and vegetables for the CVB benefit, for your WIC card benefit, or for your farmer's market benefit, all at the farmer's market if you want. So that's going to be, I mean, I think it's going to be it's going to be cool as long as we can get everybody to know that's what's going on. Okay, next slide. And then again, the World Breastfeeding Week will be coming up, and just for awareness. And I also wanted to point out down here at the bottom, the Lactation Coalition of King County. We have a great resource page on there as far as for lactation, breastfeeding, chest feeding, nursing, mother's milk support. You can find all kinds of resources and referrals for different coalitions and different organizations that promote lactation training, support, pumps, issuance, all kinds of benefits for folks on that Lactation Coalition of King County resource page. So I just wanted to point that one out, because it's a live resource. And if you have a resource that you want to put on that page, go ahead and you can, they're on the actual link, you can apply to have that vetted by the Lactation Coalition, and we're always looking for, yeah, we can send those out. As long as you can do that, Rishka, we can send these out. If you want to, if you need, you have something that could maybe be on to the coalition, you can go ahead and apply to get on there on the resource guide. And I mean, the goal of that guide is to be inclusive and to be able to serve the whole King County area with updated current information of resources, providers, organizations, events, and things like that. So I wanted to point that out. I think we're getting down here to the end of the slides. Let's look at another one. Yes. Okay. Yeah. About quality website or. Yeah. Benefits of breastfeeding. Yeah. Referrals to the WIC program. This is on our webpage too, but I just wanted to say that we do have this parent-child health referral form for our different programs. If you want to refer somebody to WIC, you can use that form. And we also have a WIC at kingcounty.gov web page that you can send a note to if you'd like to too. If you aren't able to get through to a clinic or you have an issue that you need help with, you can use that email as well to get through to WIC admin, which as well is kind of me and right now. But I definitely keep up on all of that. I try to, and we try to be very responsive. It's super important to us that we follow up with every single person, that reaches out to us as soon as we possibly can. Okay, next one. Okay, there's fresh fruits and vegetables. So I think that's what I have. Let me see if there's something else I was going to talk about. Yeah. Any other questions or thoughts about the WIC program, or any experiences that you have had, or that you have participants that have had questions or things that have come up through your work?
I have one question for you. I actually work with Richie at KidVantage, and we're looking for we used to have a WIC flyer that we would distribute, and all of our maternity items we give out to new and expectant moms that gave just like introduction into WIC. Do you guys have just some sort of basic flyer that's just kind of an introduction to WIC that we can share? Because somehow we had one and we don't anymore. But we want to make sure we're sharing.
We have a basic WIC flyer. They do. You can actually download it from the state WIC website too. You can download the basic WIC rack card flyer. But if you want, I could probably get some to you if you send me your address. I could get you some.
Sounds good. I'll send you an email. Thank you.
Yeah. Do you see my email at mara.andrus@kingcounty.gov?
Yes.
Okay. Okay. Yeah. Send me that, and I can get some for you.
Perfect. Thank you.
Yes. And it might even be that we could put some at KidVantage too,
Mara, I have a question.
Yes.
For our families, one of my families mentioned that they just go there, and do they have, because she said, oh, I just went there and did all the process when in the first visit when she went there. Oh, families can make appointments?
Yes. Oh, yes. Families can totally make appointments. Absolutely. Okay. Yes.
Do they need to go to your website and make the appointment in there, or calling, or how is the?
They would need to call the site, or they could walk in if they lived close. But I would encourage them to just call the site number, and that's on our directory link, right? Or in 211. If 211 or any of those have the clinic that's closest to them, if you go by zip code, you can call. You call to make an appointment. We don't have it electronic yet.
Oh, okay, perfect. Then
we would like to. We would like to.
Oh, no, you guys do amazing things. Thank you so much for all of this. But I wanted to explain to my families how they can access to the program.
Yes.
For one of my families, they went there, and in the afternoon they had the car, everything loaded. They were so happy. But some of my family, they need to make appointments because of work.
Yes, absolutely. I would encourage them to call to make an appointment. But we do encourage people to walk in as well, as long as we're open. So it gets to be tough, you know, because not all the
Yes.
smaller clinics are open every day, but yeah.
Okay, thank you so much. Thank you.
Yes, yes.
Hi, I have a question.
Yes.
For formula for infants, is it all brands or is it just one certain brand that you guys offer? Because I know a client of mine has asked that before in the past.
Right. It got a little bit interesting during that during the formula thing last year when all of the Similac was in trouble and we couldn't get any Similac, and so they were bringing in a lot of different formulas. Things were changing. We are back now. We're phasing out all of those other formulas, and our contract formula for the state of Washington with WIC is Similac. So most of our formulas are Similac brand products. We do have some therapeutic formulas, and those are specific, but we do have certain formulas that we use. And again, that's on the DOH website as well. And it's on the shopper app too, but it is Similac. And we are back to that now, which might be a question that you're hearing, because we did have all kinds of stuff available for a while there. Yeah.
Okay, awesome. Thank you.
Yeah, that's a good question too. Let's see. Nance, do you have a question? And then Jocelyn.
I do.
Yeah.
You went over quite quickly the several ways that people may get benefits, financial benefits, and using acronyms. And so
Yes,
I wonder
sorry.
if you could tell me what they stand for, and so that I can match my notes with what you were telling us.
So for the adjunctive eligibility, is that what you're asking about for the income piece?
Yeah.
Yeah, the temporary assistance for needy families. That's TANF. Temporary assistance for needy families. And then SNAP is the supplemental nutrition program.
Right.
That's a food benefit one.
Mhm.
Which other ones did I say? WIC is women, infants, and children. Other supplemental insurance, provider one would be the P1. What else did I say? Go back one more. Let's see. One more. No, forward. Maybe here. Oh, here, Medicaid. Temporary assistance for needy families, and basic food is the SNAP. I mean, those are the main adjunctive eligibility ones.
Okay. I think what I'm really asking is, okay, can you summarize the acronyms for the benefits that are loaded onto the cards?
The benefits. So the
money that's loaded onto the
the CVB, the cash value benefit. That's a confusing one for sure. The fresh fruits and vegetables is the CVB, which is a cash value benefit, and otherwise it's milk and eggs and whole grains and proteins and fresh fruits and vegetables. Yeah.
Okay, that's the one that's called the CVB.
The CVB was the additional fresh fruits and vegetables that the federal government allowed during COVID that's still going on. And that's the one that sounds weird, the cash value benefit. Yeah. This
Okay.
one. Yes. Good
So
question.
what are the benefits that are loaded on normally before you have that additional benefit?
It is about $12 of fresh fruits and vegetables per WIC participant, depending on what category, if you're a child or postpartum mom, but that's basically just a small amount of fresh fruits and vegetables.
Okay, what do you guys call that or give an acronym for?
We don't have an acronym for that one. That's just the fresh fruits and vegetable benefit on the WIC.
Okay.
Yeah.
Okay.
Yeah. And then we have, I know which one. So that's probably where the confusion came, because we have the FMNP, which is the farmers market program. And that's a seasonal benefit that's coming up right now. And so that's something that we do first come, first serve just during this time of year. And that's something that we do that the state and federal government offer just seasonally to help promote farmers markets, to help promote fresh fruits and vegetables. And that's called the FMNP, Farmers Market Nutrition Program. And there's that's for seniors as well as for WIC.
Very good.
And then you've got the WIC fresh fruits and vegetables, and then you've got that cash value benefit. So those are
Yeah.
the three exciting things about the fresh fruits and vegetables. Yeah.
That's perfect. Just
Yeah, that's, I can see. Yeah, I probably didn't explain that very well. There's a lot there.
there's a lot.
Yeah.
Thank you.
Yeah.
And the CVB is through the state.
The CVB is through the federal government in the state. Yes. So the feds approve it and then the state implements it through the state level. Yeah.
Okay.
So the funding comes from the feds and then
Where
comes
does the funding for the WIC?
totally a federal program
That's
implemented through the
federal?
state level. Yeah.
And where does the funding for the farmers market benefits come from?
Same federal program that comes is implemented through the states.
Very good.
Yeah.
It's wonderful.
Yeah. Yeah, and we were funded here in King County through that, through the state WIC program, through the federal program, the state WIC, and then also we're supplemented a little bit with our Best Starts for Kids. So in our general fund,
Thank
mostly
you.
our general fund actually for WIC now, I think.
Okay.
Yeah. So what am I going to send you guys? I'm going to send you the link for the open houses, the WIC income guidelines, and then you can send out the slides too. Okay.
I think Jocelyn and Martita, I think you both had questions, right? Jocelyn, you had a question?
Yeah, thank you. Mara, you kind of went over a little bit at the beginning. I was just curious as far as for example, if a family was receiving was on the SNAP benefit program, they would be eligible to also apply for WIC program for children under age 5 to receive
Yes.
that additional support with food, healthy food options, and the other services that you offer.
As long as they income qualify. So we have to look at those income guidelines, and they'll need to show proof of income and like a pay stub and you know, family income. But yes, they very well could qualify for WIC.
Awesome. And then I have another question as far as like with WIC. I know I don't want to generalize, but I know that we kind of serve some of the similar populations. And as far as like WIC clinics, are they open to collaborating with like organizations that we're all from, as far as like having families that are in the WIC program, just dropping off flyers about the programs that we offer, services that we offer? Is that something that your clinic is, your program is open to?
Yeah.
I don't want to say collaboration or like partnership, but just like, are we able to drop off flyers for the programs that we provide? And
yeah, I mean, I think that it's awesome. I do feel like that has to go through with King County, that has to go through some approval though. So it would be good to probably reach out to me and let me know what you're thinking, and then whichever site you're thinking of sending them to, and then I can connect you to do that. I think that would be the best, as opposed to just going by and dropping it off. But yes, we definitely have at all of our main sites, we have spots for different collaborations. I wouldn't encourage you to just go drop it off, because they'll not be sure if they should, you know, people would wonder if it's approved or whatever, right? So but I can do that. I have done that before, and some things are, like if it's a study or something, sometimes the public health gets a little bit might not approve that at certain sites, but basically any outreach stuff like kaleidoscope groups or any of the things that you guys are doing, I would think we would want to collaborate, right? Yeah.
thank you.
Yeah.
Martita, you had a question?
Yes, thank you. When you mentioned, Maria, you mentioned that you receive funds from the federal, this is a federal fund program. When we have undocumented families into your program, how do you guys protect that information? I know that when the federal funds, you have to report. So, because I'm just concerned about that.
Right. No, I understand. According to all of our WIC policy and our federal guidelines, everybody is protected. That information is protected in our systems. I mean, we totally do not share information on immigrants and refugees or any status. So It is protected information. We do use the data to help us provide better services. So we do check, we do ask race and ethnicity, and we do keep track of that data, but it's all not by individual. It's just in the record, in the electronic record. You know what I mean? It's we do keep that data.
Thank you.
Which is how we fund the program. But
Yes.
yeah.
Thank you for answering the question. And
Yes.
thank you for all you do to support families.
Oh, thank you for all that you guys do. And we will get some more brochures to you to help promote WIC. And yeah, we're seeing an increase with the SNAP having been decreased. So definitely we'll get people seen and get them the benefit. We're only serving half of the people that are eligible with Medicaid in King County right now. So we would
Thank
like to
you.
reach more people.
Yes, and I sent you a text message or message through here, direct message with information. So I would like to get in touch with you as well. Thank you.
Okay, let me make sure I got it in here. You
Yes.
might be better to send me an email, but did you guys get my email?
No.
Oh, let me put it in here, you guys. So I'm sorry, I should have put that in there.
It's
Thank
all
you. Thank
good.
you, Maria.
I can include that in the email that I'm going to be sending after the
Oh wait, this
training.
was a direct message. There's that one. Let me send to everybody,
Thank you.
to everyone. Here, I'll put my email too. Yeah, so send me that to send it to me, and then I can keep track as I'm sending back, and we can communicate.
Thank you, Mara.
You're welcome. Thank you so much, everybody. It's been a pleasure talking with all of you, seeing some faces. We'll hopefully we'll be seeing you at some of the events. We've been going to a few already. I've been to like 10, I guess mostly South County, but we'll be coming north again more too, so.
Perfect. Thank you so much, Mara. I mean,
Welcome.
as everybody is saying, this was so informative session, and not just for the providers, the programs that are helping the families, but also we had people from our team join in and get some information, and it was so informative. So thank you so much, and then we'll continue with this association and see if we can bring in some more informative sessions from you, Mara, or your team. And extending thank you to all the providers who were able to join in, spend your lunch hour with us, getting some more information in supporting families. Next steps are going to be, I'm going to be asking my colleague to process this this recording, and then we will be adding this talk on our YouTube channel. I'll be sending an email with the link of the YouTube channel along with the presentation and Mara's detail, so everybody would have that information. And I'm sure in between Mara will send me the open house flyers, which I can also include it in the email and share it with everybody. So with that being said, if there are no more questions, once again, thank you everybody for your valuable time this afternoon. And this basically gives me the motivation and inspiration to plan some more sessions, informative sessions for you all. So if you have any suggestions, requests for any specific topics that you would like to learn more about, please shoot me an email, and I will do my best to connect with the experts in the field and bring them to you in the form of a lunch and learn session. So with that, once again, thank you so much, Mara. It was great. We all enjoyed. And as you can see, a lot of folks had so many questions about WIC. And it was a worthwhile and the most informative session. Thank you so much.
Thank you. Thanks, everybody. Have a good day.